Hi, my name's Suzanne and I have stage 4 gastric cancer. My metastasis is through my skeleton. I've been on chemo and immunotherapy for 13 months and it's still first line and I feel great in between treatments, and I'm hoping I can stay on first line as long as possible, and then maybe, who knows, maybe I will be able to find a way to control the cancer without chemotherapy and just immunotherapy and integrative therapies. But even if I can't do that, I will still continue with the integrative therapies because they keep me feeling good between chemo. And as long as I recover and feel good between chemo, then I can keep doing it. So first off, most important thing that I've done is acupuncture. Because without the acupuncture, the side effects of the chemo, I think, would have been really not tolerable. I don't have any neuropathy. I don't have the aches and pains in my body. It just has done a world of good. I see Claudia at my cancer center at Frederick Health, and I see her every week. She spends a lot of time talking to me about exactly what I have going on in the moment. So if I'm tired, you know, if I'm full of energy and I feel great, she just wants to boost my immune system. Sometimes I have aches and pains. At the beginning, of course, it was all about the neuropathy, and she fixed that for me. And then I do see a second acupuncturist in Bethesda, and I see her maybe twice a month, and I get traditional Chinese herbs from her. Her treatment is a little bit different. She knows what I have. She comes in, she puts the needles in, hooks me up to a little electrical machine around my stomach, and I get my herbs and I go. So I take my herbs every day, twice a day. It's like a tea. I think it's a lot of mushrooms, ginseng. I don't know everything that's in it, but I don't know what's in Opdivo or chemotherapy either. So I trust her. She's a doctor. And I know that the herbs and the acupuncture are making a huge difference for me. And I know that these things can be expensive. Right now, I have help with my cancer center. If you're on active treatment, they give you a really good rate. Hopefully someday I'm not on active treatment and I have to pay full price. I mean, wouldn't that be great? So if I can't afford it, I'll find a school or a community acupuncture place or somebody that wants to trade. There's always a way to get it done. So I also get massage once a week, which is quite a treat. And I always joke, it's like going to the spa. My cancer center is like a spa. But in all seriousness, it has helped quite a bit. Again, just I feel a lot of sensation coming back into my joints, into my hands and my feet when I get my massage. You just don't feel good when you're getting chemo, and it is quite depressing, almost a little traumatic each time you hear some bad news or you have to have chemotherapy, and it's really hard. And the massage kind of keeps you going, keeps your energy up, and it's made a big difference for me. I'm very grateful for it. And again, it's at my cancer center, so I get a great price. Lana is so professional. She's so good at what she does. If I didn't have that, I don't know where exactly I would find such a good massage therapist. So I'm very grateful for that. So as far as supplements go, my doctor told me, and I do listen to my doctor, at the beginning that I should take Centrum Silver. So that's what I bought. I probably won't buy it again, but I take it about twice a week. I don't take it every day. The last time they tested my blood, actually I had super high B12, and this has way too much B12. So I take it about twice a week now. I was taking it every day. But these things are expensive. So I'll use it up, and then I'll probably go to the common market and find something a little bit different. And then I take my calcium every day. It has a little bit of vitamin D in it, but I have bone metastasis, so it's super important that I have my calcium at exactly the right level, and they test it every time I go. If I take too much calcium, then I know it. So I think I've got I'm taking 1 a day plus the calcium that's in the multivitamin, and that seems to be just right. The other thing that I do is a prescription vitamin B2, and this is once a week. And then I have a vitamin D3. My doctor prefers actually the D3 to the D2, but the D3 once a day doesn't get it up to the right level. So I'm taking the D2 as well. And then my regular doctor will check my levels, because I think it's really important that you just don't guess at what you take, that you really are having the levels watched, especially vitamin D is a hormone. Like you can, it's not like vitamin C where it's water soluble and you're just gonna pee it out. You need to know if you're at the right level. So those are my vitamin Ds. And then I do have a vitamin C, it's buffered because I have stomach cancer. I don't want a real acidic situation in my stomach. So I just pop these throughout the day. It's a buffered vitamin C. And then at night, these are my Chinese herbs. At night, if I don't have anything going on in the morning, like say I'm working or I have a chemo treatment, if I have to be somewhere early in the morning, then I don't take these. But if I don't have to be anywhere until 9 a.m. or after, then I take my melatonin and my magnesium. So those are my supplements. I'll probably add some more, but I only add 1 supplement every month or so because I'm on a lot of different drugs, and I think it's really important that if your liver enzymes go up or something's not quite right, if you've added 3 or 4 supplements and then you're on all these different drugs at the infusion center, you don't know what the problem is. So that's what I do. I add a little bit at a time. So that's where I am right now, and I will continue to add more supplements to my routine. And then, I have other little things that I do now and then. Herbal teas. I have a lot of herbal teas. I have some elderberry syrup, of course, apple cider vinegar. I have some of the the hydrating, but I don't do any of those kind of regularly. I just do them occasionally. If I feel like people are sick around me, I'll do the Zicam and the Neti Pot in my nose, and I also sometimes will do the ear candling. But those are just kind of as needed things. My Claritin here is when I get, this is of course not holistic, but when I get my Neulasta, I just take 1 Claritin to keep the histamine down, and I don't get as many aches and pains. So, and also my dark chocolate, I get my 85% cocoa dark chocolate, and I have a little piece of that whenever I want something sweet. I've heard many doctors say you can drink all the bone broth you want. It's not going to make your white blood cells come back. But actually chocolate cocoa is supposed to stimulate your bone marrow. So I don't know if it does, but that's what they say. So I eat a little bit of chocolate. And then as far as food goes, I do consider my juice part of my supplement program, and I drink green juices when I'm out. Like, so if I'm at the Common Market, I get their electric green lemonade, different juice places where my boyfriend and I travel. I will get green juice because it's a pain to make green juice. You have to buy big containers of spinach or kale, and it's a lot of waste. So I just would prefer to get it when I'm out. But at home, I juice fresh ginger, and I don't really like the taste of it, so I have it with orange usually, and maybe some apple. And then turmeric is pretty yummy. You can add it to anything. So I have my fresh turmeric. And then I do a lot of pears with celery. And sometimes as a special treat, I'll get a big container of fresh grapes. And and have that juiced. And my girls love the grapes and my girls love the orange juice. And so I think juicing is really important. Sometimes, especially with chemo, you're very, very tired. And as important as fiber is, it's a lot of work for your body to digest fiber, to digest a lot of animal protein, and fresh juices give you that instant boost of energy, and it's no work for your body to digest it. So I think juicing is very important. I think it's like like an IV infusion, but just fresher and right there for you and affordable. So that's what I do as far as juices go. And then I just play this little game with myself every day to try to eat as many superfoods as I can. So I try to eat a lot of sprouts. I try to eat a lot of broccoli. I have my chia seeds and my flax seeds and my almonds. I try to eat almonds on an empty stomach. It's supposed to keep the acidity down, but you're getting a lot of protein and it keeps your blood sugar good. And then I also fast. I don't eat anything in the morning until I'm really, really hungry. And sometimes that's 2 o'clock in the afternoon. So I just don't eat until I'm really, really hungry. And I think that is a healthy thing. And it also is supposed to help with your blood cells, your bone marrow, making your white and red blood cells. And then I do drink coffee, but I always get an organic dark roast. Dark roast is actually less acidic. You wouldn't think so, but it is. So I drink organic dark roast, either my little K-cups or just, I get actually a really nice dark roast organic from Aldi. So then as far as skincare goes, that's my line of work. I'm an esthetician, so I have my organic skincare that I use. I'm not using anything inorganic right now, except for, of course, sunscreen. I have to have my sunscreen on. And you know, sunscreen is a chemical. It's not going to be organic. And then as far as treatments, I do use frankincense. Frankincense there's been lots of clinical studies that show it penetrates the blood-brain barrier. They've used it to shrink brain tumors in mice. So, I mean, if NIH is studying frankincense and baby Jesus used frankincense, I'm using frankincense. So I put it on every day, mix it with coconut oil, and then I just add a couple drops of something nice like rose or jasmine so it smells good. There's a very masculine, woody kind of smell to it. But that's what I use. I put it all over my body, and I know that it penetrates, and I think it might help. I don't know, but I think it might. And then I spray some frankincense kind of in my hair because I know it's good for your brain. And because I had metastasis through my spine, I want frankincense around my brain. I don't know if it does anything, but it certainly doesn't hurt anything. And of course, I'm sure everybody's using a natural deodorant now. And then as far as exercise, I do yoga 3 or 4 times a week. My boyfriend and I hike all the time. And then I do go for long walks, and I'll run a little bit, walk a little bit, run a little bit, walk away a little bit. As far as weight training goes, I try to do some weight training. I don't do it when I'm getting chemo because I don't want my muscles to be sore and to have a lot of acid in them. So I do weight training when I'm not getting chemo. So that's what I do to try to keep myself strong between treatments. And I hope that there's little tips and tricks in there that will help you feel better between your treatments too. Thank you.